near my mouth, I think.
Very good. Good idea. Right, well, there's lots more people just joining us now, so I'm just going to let them trickle in because we did send them off to have a cup of tea and a bun themselves, so we don't want to start before most of them are back and ready to join us. So I'll stick myself on mute so you don't have to listen to me shuffling the papers.
I'm just locking the clinic room door in case somebody comes to visit me while we're here.
Very wise.
Get a bit of entertainment from a pregnant mummy. How are you, Mary?
I'm not too bad.
Good, good.
I was really nervous about how this was all going to work in terms of joining in when you were kind of leaving one talk, but it's going really smoothly, very smoothly.
Good.
A full day yesterday on the IHV conference as well. So
I know I saw you on Twitter, Mary. Yes. Was it a good day?
Yes, it was a very good day. Very good day.
Good. Glad it went well. And it was International Day of the Midwife yesterday.
Yeah, absolutely.
Yes.
Seems to be a lot going on this week and next week, you know,
Yeah.
days of and weeks of.
Yes.
Lots of overlap.
I know.
It was great to hear Minister Swan making the reference to the mother and baby unit business case commencing.
Great.
Mm-hmm.
In time for me to be the tea lady.
I hope it doesn't take as long as the business case for the teams.
Oh, I know.
It's a very complicated process, but maybe having made a start, the next one will be
Yes.
more straightforward.
Yeah, a lot of learning from that.
Yeah, yeah.
Just give it one more minute because I can see definitely lots more people filing in now, and just so
Filing in.
Yeah, they're all lining up and coming in. And because
Wish we were back in the Mac Theatre.
Oh, I know.
Yeah.
I know.
I know, that would be lovely. Actually, it would be so nice to be together in person, and Michelle and I wouldn't be so frazzled by this tech. She's brilliant. I'm just rabbit caught in headlights trying to click the right button.
I couldn't even begin to imagine what it must be like to coordinate all of that.
Well, it's definitely been interesting.
Another learning experience, Lindsay.
That's exactly it, Scotty. Plenty of.
I just don't seem to be learning. There's always different platforms and different rules, and I just don't seem to be making much progress. I still get a very strong stress response to the IT side of things.
Oh, well, if you could have seen us here first thing this morning, well, that would have been interesting. And okay, so it's just after 9:30 now, and we have a good number of people here who have joined us. So I will officially start the session, just to say thank you to everybody who has been with us already this morning. If this is the first session you're jumping into, it will be absolutely wonderful, I know. If you've been with us all morning, hopefully you've enjoyed it so far. If you do have any questions that you want to ask, we'll try and make a bit of time for those at the end, and you can put those into the Q&A down at the bottom, and we'll all be able to see those, and I will try and ask them at some point. But we do have some questions that we have sourced beforehand, so we've asked some people what they would like us to ask our wonderful healthcare professionals, and these are the most popular ones that we have chosen to chat about today. And so I'm absolutely delighted to welcome these 5 wonderful women to our maternal mental health conference. All of them have been involved in the conferences all before, but all of them are experts in their respective fields and have been huge champions for maternal mental health, for perinatal mental health, and also for the specialist services. And I, as a mum, have been absolutely privileged to work alongside every single one of them in different ways on different days, but it's just been such a joy, and I am so thankful for the work that they do. And so what I'm going to do is I'm just going to ask them each to tell us their name and to tell us their job title, just so that I don't get anything wrong and they can get it completely right, and then we'll begin and ask questions. So I'll go around my screen, and Julie, could you introduce yourself please to the panel?
Sometimes I'm not sure who I am and what my job title is, Lindsay, but The screen says that I'm Julie Anderson, so I am a consultant psychiatrist in the Northern Trust and work with the very wonderful community mental health team in Newtonabbey and do various other things to do with education and training at Queen's and other places as well. And I suppose have kind of been a small part to play in this wonderful, interesting, painful, exciting journey over the last number of years as we kind of move forward with developing perinatal services locally.
Thank you, Julie. Fantastic. Janine, can we come to you next?
So I'm Janine Lynch, I'm a consultant psychiatrist and I work in the perinatal psychiatry team in the Belfast Trust and have been involved for a while now in the service developments.
Fantastic, thank you. Shona.
Hi, Lindsay, lovely to see you all. I am Shona Hamilton, consultant midwife in Northern Trust, so we work across Antrim, Causeway and community. And I have been talking about perinatal mental health for a very long time, thus the wrinkles on my face.
Scotty.
I'm Geraldine Scott Hayes, or commonly known as Scotty, as Lindsay said, because it's much handier, less of a handle. I am a consultant clinical psychologist. I have worked in the Royal Jubilee, originally the Royal, now Royal Jubilee Maternity Hospital since 1999. I'm actually, shall we say, in the process of retiring. So Andrew Locke now leads that service. I still support it and contribute to the regional implementation work.
Fantastic, thank you. It's wonderful to have you. And Mary.
Mary Duggan, health visitor, and thank you for having me here today. I was a health visitor for over 35 years, and for a lot of that time I've had a particular interest in the area of perinatal mental health. I retired from the NHS 2 years ago, but I've still obviously been very committed to the area of perinatal mental health and deliver some training with the Institute of Health Visiting and also support the perinatal community of practice for the PHA.
Fantastic. Well, you're all very welcome and thank you again for joining us today. We'll dive straight into these questions that we had sent in and I think you hopefully have seen them, so you do have a bit of an idea about what's coming up, so I'll not try and shock you with any of them, don't worry. But our first question is looking at the idea of a mental health epidemic, which we have heard about quite a lot due to the impact of COVID that has had, I suppose, on all of us. And we wondered around your respective areas and your areas of expertise, what has that looked like, or what does that look like, or have you seen that, or give us a bit of an insight into, I guess, maternal mental health and well-being and the whole issue of COVID. I'm happy to pick somebody, but if anybody has a burning response they'd like to get in first, please jump. Okay, Julie.
Maybe if I jump in simply from the maternity setting, because obviously there's been a huge difference for all women coming to maternity services since it started. And, you know, it has completely put a halt, even reversed a lot of the progress we had made in providing psychologically informed care. You know, it's left women isolated at times when they really desperately need support. And certainly among women I've seen during this time, though, their fear about coming into hospital without their birth partner, going through a large part of labour without that support, has been really very difficult for them to cope with. And of course that continues in the postnatal period, because even grandparents haven't seen babies for months and months, and that means mums and dads haven't had the support of extended families. And we all know that when it comes to mental health for any of us, isolation is a real risk factor. And we never need that support more than when we're in the perinatal period. So I would say definitely there's been an increase, and in the way things are, I think there will be a long tail to that, to those difficulties, regardless of whether it's mild, moderate or severe mental health issues we're talking about.
Thank you for that, Scotty. And actually, really interestingly, in Emily's session, she sort of polled the room and asked what the room was most concerned about around the impact of COVID. And the thing that came up in most of the responses was that issue of isolation and people feeling very lonely. Nearly everybody said that, as well as something else, which I think is really key. So you're absolutely right. Thank you for that. Anybody else from their respective area want to jump in and share what they're thinking?
I think Scotty's right. Lindsay, you know, I think this has been the most challenging year as a midwife in the midst of COVID. You know, visiting has decreased even for birthing partners. Birthing partners can't come You know, when women are having induction, come for scans, come for difficult conversations, it's been a huge challenge to try and get it right. And as a result of that, absolutely, I think all the midwives would agree that there has been just a heightened sense of anxiety and fear, and as Scotty said, that sense of isolation. And you know, you spend so much time, you know, very often with women in pregnancy talking about that postnatal period and who your support mechanisms are, and who's going to keep you well, and what's that going to look like from a social point of view. And gosh, you know, it's nearly even difficult to have that conversation, because it felt like, what are we going to do? You know, how are we going to get you some social support, because it wasn't out there? So yeah, it's been hugely challenging, and I do wonder what that's going to look like over a period of time. And I suppose for Mary and health visiting, they see that a bit longer on down the road than we do, and then subsequently you know, services such as Julie and Janine. So yeah, it's been hugely challenging year, really tough around that. And I suppose we really felt for families in the middle of this, in terms of trying to find support mechanisms.
I was just going to echo the kind of point of isolation. I know we've sort of talked about it already a little bit today, but I suppose just if you think about people, I know we're all different, but everybody needs connection. Everybody needs, you know, community, and needs to have a sense of belonging at the kind of very core of who we are as humans. I know some of us need that more than others. But I think that's just generally been the most really quite horrific thing about COVID, of kind of just the impact that that's had on people generally. And I suppose even talking from a personal point of view, my babies are now 16 and 13. And my husband's not watching, so I can say nice things about him. But I certainly know the thought of him not being there when I was getting induced, and not being, you know, kind of there, you know, during that whole sort of even just maternity journey would have been horrific. And I know as well, my mum at that point was working part-time still, so she was off on a Friday. And I remember being really very cross in those early kind of days with my first one, if she was not at my door at 9 o'clock in the morning, just to be and, you know, sit in the house all day. You know, so for mums not kind of having that, and even mother and toddler groups and different things I would have done kind of within church and those kind of things in those early couple of weeks and months were vital. You know, they really were. Because being sort of isolated and unsupported and left with your own thoughts apart from anything else is often really not a good thing. And I suppose just talking from a very general community mental health point of view, not even specifically perinatal, I suppose we're really seeing in our team in Newton Abbey just that real lag. So people aren't getting picked up early. And I suppose we talk all the time, and I talk to medical students all the time about mental health generally, and the importance of identifying problems really early and picking them up early and intervening early. And I think as well, that's kind of been another real challenge, that actually mums and people generally, those kind of early mental health difficulties are not getting picked up early. There's not that same face-to-face contact. There's not the same contact with families and health professionals. And so problems go on for a bit longer. And then that makes it even harder to, you know, effectively and quickly sort of intervene. So yeah, it's been tough, and I suppose I agree with what Scotty said. I think there's just going to be quite a long tail as such on this, and you know, of the impact of COVID, even as things start to improve now.
Yeah, I think, I mean, I would just endorse what has already been said, but I suppose I'm actually going to suggest that there has been an epidemic in the whole area of perinatal mental health for years that has not been recognised. I mean, I think those of us who have been around for a long time have been saying, you know, it is a public health issue. And at least I feel now that the mental health is very topical in the whole area of COVID. But I suppose listening to practitioners who are in the field, I mean, just what I was saying, the opportunity for prevention, early intervention has gone for many of these mothers and families. And I think, you know, health visitors have been very innovative in terms of how they've attempted to support families where they possibly can. And I think, you know, it's really important not to underestimate the value of a telephone contact. But there's nothing will ever replace the face-to-face contact and the social support and professional support, which just has not been readily available for families at this time. And I mean, everyone is saying very clearly there's a big increase in the numbers, particularly anxiety.
Thank you, Mary. Janine, did you have anything else you wanted to add?
No, I mean, I think everybody said things, Lindsay. I'm a wee bit, I don't think the research is fully there yet to say for sure the impact. You know, I've seen some conflicting research, about the impact. So I think it's a wee bit early to say sure. I certainly agree with what everybody's saying about the support, you know, the lack of support that's there at the moment.
And I think, Mary and Julie, you have touched on this already in your answer, but it would be good to hear a little bit more about any of the specific challenges that you as healthcare professionals are experiencing around this time about being able to get mums help and support for their perinatal mental health. We often as mums talk about the experience from our end and maybe accessing that support, but I mean, I know Mary and Julie, you touched on that a little bit from your point of view. Anybody else have anything to say about, as healthcare professionals at the minute, trying to make sure that mums access that help and support and that we should be hearing?
I think it's a real problem, Lindsay, at the moment, the fact that a lot of organisations and support services are not going out into people's homes at the moment, you know, obviously for very good reasons, but that is a real problem for us. So, you know, for example, we would make a lot of use of organisations like Sure Start, who are absolutely brilliant, and Sure Start, you know, everything just mainly, not completely closed down, but certainly all the support groups and things like that closed down. Women weren't getting home visits, and I think that was extremely difficult. So hopefully we will see that start to change over the next few months.
Thank you, Janine. Anybody else wanted to reflect on that at all?
I think a lot of therapy continued remotely. So certainly our department, we were doing remote sessions or telephone sessions with mums, but yes, when I did it, even when I overcame the IT, it's not the same as sitting in the room with someone. It's just not the same. You cannot establish the connection in the same way. We're doing, because there's been a lot of remote work across the different psychology departments in the Royal, we have done a sort of survey to get how, you know, patients, clients, to get feedback from them on how it felt for them, but we don't have that information yet. But no, to me, it felt more superficial. It was still useful, and I think women appreciated that. But for example, working with a couple is more complicated, and it just doesn't. To me, it felt that I wasn't really getting the same connection that I would have done if I'd been sitting in the room with the person or with a couple. Yeah.
Thank you, Scotty. That's really important. And I think it's really important actually that we all hear from your perspective what it looks like for you, because all of us only know our own perspective really. So it's helpful that. Shona, what about you from a midwifery point of view?
I suppose, Lindsay, the great bonus of midwifery was that we just kept going. So you can't catch a baby via Zoom. I haven't tried, but I would say it's difficult enough. So I suppose we still got that one-to-one, and we still got that face-to-face care, which was, I suppose, a great bonus. And the other thing I have to say is, I know it's been a challenge, and I know for teams and healthcare professionals it was a challenge, but I think, like always, people pulled out the stops, and if we were worried about women or there was women in need, I think we always managed to get them care and help when it was required. So I suppose I want to be reassuring from that point of view that the world didn't end, and I suppose I think we're very lucky that that we have so many connections in perinatal mental health, and it's, as I always say, it's easy to find a friend, to get somebody care and attention. So that did carry on, and certainly Scotty's absolutely right. The feedback from women very often was that they found telephone consultations, those sorts of things, challenging and difficult, because you're right, body language and warmth and all those things come with sitting side by side, don't they? And but I suppose I would reassure people that everybody still pulls out the stops in the midst of COVID to try and make it happen as best we can, sometimes in a slightly different way, but I think it's the care is still there. Yeah,
absolutely, Shona, and we're very thankful for all of you do. Mary, sorry, go ahead.
Yeah, no, I suppose one comment that health visitors had made to me was in terms of access to general practice, because they were working quite differently. For some mothers, that was actually very, very challenging. So the health visitor would have acted as an intermediary between both, in terms of sharing information, but we know how important it is for particularly if a mother started medication, that's monitored by the GP and reviewed by the GP. So I suppose that has been difficult, and some areas that's worked much better than others. And I think, you know, it's a collaboration between all the professionals involved in the journey for these mums and families that's really important, and I think something we can learn from and do better.
Absolutely, thank you. And so maybe we'll
Can I just say, I think in some instances it was maybe helpful for postnatal mums, because some mums found it so I was talking to mums while they were breastfeeding and had the baby on their knee, you know, mums who would have found it very difficult to get up and out and ready and everything and come for an appointment. They more than anything appreciated the ease of access. So I guess there was that positive aspect to it, and maybe something for us to bear in mind in the future.
Yeah, very important. Thank you, Scotty, for that. So I want to make sure that we move on to this next point. We've been talking about something that's particularly difficult, and we've all had difficulties in it, but I'd like to talk about something that's quite exciting and that every single one of you have been so instrumental in bringing here to Northern Ireland, and that is the news of the specialist services and the 5 teams that are going to be implemented across the trusts. And I think there's been a huge amount of buzz already today about this news, particularly before this, but actually on the conference, everybody's really keen to talk about it and hear a bit more about it. So I'd just like to hear from perhaps your professional experiences, a few things. So maybe one of you, and maybe Janine, you want to jump in to begin with and tell us what we can expect these to look like.
Okay, Lindsay, I actually made a quick note of all the members of the team in case I left anybody out and somebody got offended. So what will happen is, as you know, we've always had a very small team in Belfast, or not always, but we've had it for about 15 years. So what we will have is a specialist perinatal community team in each trust. And that team will be made up of a number of members, medical staff, psychiatric nurses, psychiatric social workers, psychology, OT, maternity staff, including a health visitor and a specialist midwife, and peer support. I don't think I've left anybody out, is that right? I forgot everybody there. And the teams will take referrals of women with illness, with psychiatric illness in pregnancy and the postnatal period. Those referrals will come from either the GP or from maternity services. And the woman will be seen and assessed, and if it's felt that they are in need of the service and will benefit from the service will then take them on and work with them in a number of different ways, which is, you know, because we've got that wide range of professionals, we're going to be able to offer a number of different therapeutic options. And, you know, hopefully this is going to massively improve things for women with mental illness at this particular time.
Yeah, it really is fantastic news. And we've heard just a minute or two ago some testimonies from those who have had access to specialist teams through whenever they have been unwell, and the huge difference that has made. So we know that mums are hugely encouraged to hear this is coming. Julie, from your role, because you are, I'm going to try and get this right, the chair of the perinatal faculty here in Northern Ireland, is that right?
Called a committee now, but yeah, something like that. So yeah, within the Royal College of Psychiatry. So we've had a perinatal committee or faculty for a few years now, just I suppose to develop connection among the different psychiatrists and to kind of link in with other places and other teams to get things move forward and look at the training as well. I suppose has been another big aspect as well as the new teams.
Yeah, so the training is still ongoing, isn't it? Is it part of what you're continuing to do?
Yeah, so I suppose there's lots of different aspects of training that have happened. I suppose the most significant one, not if that's the right way to put it, has been a sort of 2-day training package that has been put together with the people on the screen and others that has ran quite a few times over the last 2 or 3 years now. We did have a bit of a hiatus, as many things did with COVID, but we made a comeback on Zoom at the end of February it was. And so I suppose I would certainly hope that we would continue to be able to do that quite intensive 2-day sort of training every sort of 6 months or so roughly, to kind of, and I suppose that the main thrust behind that was to kind of upskill staff so that there would be people ready to get started in the teams kind of as soon as we get the go ahead and recruitment happens and those sorts of things. So that's kind of ongoing, and that's been great. And I suppose kind of another lovely piece of collaboration really, you know, across kind of very many different people. So, and there's other little bits of training that have happened in kind of smaller, more targeted ways as well across the trust, just to kind of upskill, I suppose, the broader mental health workforce and increase people's awareness around the particular sort of complexities around the more severe end of the spectrum, I guess, with perinatal mental health.
Brilliant, thank you, Julie. And Scotty, you have been campaigning on this issue for many years. I hope it's okay to say that.
Yes. Mary and I go back a long way. Further when we care to admit.
Indeed.
I wondered, from your point of view, and certainly from the psychology point of view, would you like to offer a reflection on the specialist teams and how we're moving forward with that?
Well, I think it'll be great to have these multidisciplinary teams, because exactly as Janine says, it gives women options. It means different sorts of therapies can be offered, either singular or combinations of. And I think we're most likely to meet not just the needs of women, but the needs of the entire family in that way. So I just think it's great. I mean, working in the regional maternity hospital, obviously women come there from all over Northern Ireland for care, and our service has always taken any woman who was booked for care at the maternity hospital. And sometimes they were going back, maybe with a baby, maybe with a poorly baby, quite a long way from the hospital, but there was no service to refer them to, which was tragic, because you knew they still needed support, they still needed ongoing care. And it was really very difficult to find the right support for people out there, or to find people who had sufficient understanding of the perinatal context to respond in a way that was appropriate. So some families ended up traveling back to Belfast to continue with us because there was nothing else. So I'm just delighted that there's going to be something local in every trust that can be accessed by women and their families.
And Shona and Mary, from a midwife and from health visitor point of view, these teams are also good news and will be implemented throughout both of those professions. Would you like to reflect on what you feel that they mean, or how that even works in with the work that you're currently doing?
Yeah, well, I mean, I think it's just absolutely brilliant that the team's there. And whilst, health visitors will be managing those women who will not meet the criteria for the specialist teams, I think really our role is going to be in work in collaboration with the midwife in terms of the identification of those women early, and that we have then the right team. And so it's really the theme for, the right intervention at the right time. And I suppose the really important thing, which Scotty has referenced there, I mean, this is a family-based illness. So, it's the very fact that the team will be able to focus on the family. And if the mother is getting the right expert intervention, it's just going to make a huge difference. And we do know that, the fact that these teams are going to be in existence, that is going to have a ripple effect in terms of practice to those that are not actually meeting the threshold.
Absolutely. And Shona, what your thoughts?
Yeah, and I'd agree with Mary. I think the exciting thing for me is it just feels like it's going to be so much more simplistic than it is now. So, it's really difficult sometimes to navigate your way through systems and teams and geography and who works where, and so I just think having one team in one place with a raft of expertise is going to make it really simple for midwives to refer during pregnancy, and therefore so much simpler for families and mums, and getting it right. So I can't wait. It's great. Yeah.
A couple of the questions, we won't be able to come to all of them in the Q&A, but I see a couple of them and focus on this, which I do think it's important that we raise, is that there is a realization that not all mums will be able to be treated within the specialist teams. And Janine, I maybe ask you about that. Obviously that is true. So how do we work with that? What about the fact that maybe not all mums who are even referred will be suitable for that, or do we have anywhere else to signpost them onto, or how will we work in that way?
Yeah, Lindsay, it's a really important question, and I'm glad somebody's made the point. Obviously there's a huge number of women who experience some form of distress in the postnatal period or around pregnancy, and not all of them. It's not appropriate for them all to come to specialist services. And what we want to do is to be able to provide the right service for the right woman at the right time. I think that's absolutely key. So we want to work alongside our colleagues in primary care and also our colleagues in the community and voluntary sector to look at a network of services and simplify the pathways between services. And we're calling it partnership working. We're already along trying to make that a reality and trying to make sure that 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 those services, either in primary care or in community voluntary work, that we facilitate. They're doing a certain amount, they're seeing a lot of these women, that we're there for support and backup. And that is hopefully the way it will work.
Brilliant, yeah, and that's really important, because there are lots of our community and voluntary sector who are joining us here today, and I know they'll be really encouraged to hear that, because they do have a part to play, and an important part to play in this going forward. I'm going to ask you, and I'm giving you a bit of warning because I don't know whether it came, I'm going to ask you all in just a minute to give me a word that describes how you feel about the future of perinatal mental health services here in Northern Ireland. So have a minute or two to think that, but there's a question in here that I'd love to just throw out and see if we could come up with an answer to it before we go to there. And so the question is, will there be a specialised team to support parents who have been given a diagnosis at the birth of the baby with a life-limiting condition or illness? I wonder if anybody could reflect on that, or even tell us where we might go to find some more of that information, because that seems like a very important question. We might not be able to deal with it all today, but would be important to tell us where we would go to find some more about that.
Yeah, Lindsay, there's a really excellent piece of work currently being undertaken around a pathway with our colleague Valerie in Children's Hospice. So that there is I suppose services there, and there is some pathways there, and we're trying to make that a more regional approach. And certainly if somebody needed some help with that pathway, or some assistance with that, there isn't a midwife in any unit that wouldn't be able to give somebody that direction, or if somebody needs direction, tell them certainly come and chat. But Valerie in Children's Hospice does fantastic work, and our colleagues in the neonatal unit, as Scotty will know, in our JMS do a massive amount of work around that. So there is help there. Yeah.
Brilliant, thank you. Scotty, did you want to come in on that as well? I know that maybe is something you have expertise in too.
Well, I think back in the day, I was able to provide a service in the regional neonatal unit on a goodwill basis. But as awareness rose and the demands from maternity rose, I'm afraid we had to withdraw in recent years from the neonatal unit, which was really tragic, because it was a benefit to staff and to families while they were in the neonatal unit. And I think it's something that we really need to go back to. And I do see that it's great that we have the specialist teams, and I am delighted. I know you want one word in that later, but anyway, and the MVU is on the road. That is great. But there has been a neglect to recognise the RQI recommendation to have psychology in every maternity and neonatal service. And really, for me, that is the route to really providing psychologically informed care in a trauma-informed environment. It's a route to engaging the whole maternity and neonatal workforce in this piece of work. And it can be preventative, especially in the area of birth trauma, or at least ameliorative. So I think there's huge potential, and I would really like to see attention turned to that recommendation.
Thank you, Scotty, and thank you, Shona, and thank you, Sarah, for asking that question as well. That's really important, and a piece of work we really hopefully will be able to pick up more and even talk about more, Scotty, as we go forward. Okay, well, it's gone 12 o'clock, so that means we're almost finished, but I don't want to finish without asking you each for your one word. So I'll go round you. You've having a bit of time to think, so I'd like one word, or it can be a phrase if you want the phrase, about how you feel about the future of perinatal mental health services here in Northern Ireland. And Julie, I'm going to go to you because I haven't heard from you in a wee while. So give us your word.
You know I'm not going to give you a word, don't you? It's not realistic. So I suppose a little bit impatient, but very hopeful.
Thank you. I echo that. Shona.
Feeling very positive.
Wonderful. Janine.
I think it's going to be challenging, because I feel a huge responsibility to get this right. We've been given quite a bit of money, and we really need to make sure that we are providing a better service for women. With that money, we've a big responsibility here, I think.
Yeah.
Mary?
Exciting. I don't know what's happened to my camera, but exciting.
Brilliant. We can still see you, Mary.
We can still see you, Mary.
And Scotty?
Optimistic.
Wonderful.
It's taken a long time, but optimistic.
Well, as we finish, I again just want to thank you all so much for your hard work all the time, but especially on this issue of perinatal mental health services. Every single one of you has done so much, both publicly and behind the scenes, and we wouldn't be where we are today with these services now coming for women and families just like me and many others who will have access to this support. So huge thank you for that. Huge thank you for all your continued hard work. Janine, did you want to come in?
Lindsay, I just wanted to pay tribute to you and what you've done here, you know, and the campaign that you have so successfully run. And we are, you know, as professionals, we are all so grateful to you for that.
Yeah, absolutely.
Absolutely.
Well said, yeah.
Great catalyst.
It's been wonderful to just show co-production and collaboration, hasn't it? And that's really key and part of all that we're going to be doing as we move forward. So huge thank you to you all for joining us, especially I know that many of you this is a working day and you're going back to work. Thank you. And we will keep in touch with you. And I hope we haven't been able to answer all the questions that were in the chat there, but we'll take a note of them and see if there's any that we can go back to people with the information for. But thank you all again. And thank you to our attendees. If you log out, you can log back into your next talk, which is Michelle Bradley, and I'll be hosting that. So I will see you there in just a minute. Thanks, everybody.
Thank you.
Thank you.
Bye all.
Bye.